course, Paola, who will be translating for us behind us in ASL and sign language. And then, of course, we have Alice from the Health Department, who will be giving a summary after we answer some questions from the media. So good afternoon again. I want to begin by giving over some of the broader numbers. I hope that folks had as good of a weekend and Easter holiday as possible. Obviously, it's very different celebrating in this era of COVID-19, but I hope everyone had a safe holiday. As of this morning, we now have 350 cases total in the city of Long Beach that are positive, of folks that have tested positive. That number continues on a daily basis to increase, and I want to just share again that that number we should expect to continue to increase. So again, that number is 350. Also, obviously sorry to share that we are now up to 14 deaths that have happened related to COVID-19. That is also, unfortunately, a number that could continue to go up. As we know, there are others that are in our hospitals, that are hospitalized, that are fighting to stay healthy. And so we know that that number is a critical number for us, and we continue to watch that number. Let me add that while the number is approximate, we know that over between 140, getting about 150 individuals have recovered. The reason why that number is an approximation is because we don't have the exact data of everyone recovering, but there is that recovery process that is happening. As it relates to those that have passed away, the 14, we know that all of them had other health conditions. They have been in the between 50 and 80 in all those 14 cases, in 50 or through their 80s. And we know that about half have been connected to our skilled nursing facilities and our retirement facilities. And so that is an area of concern for us, and it continues to be. But our efforts here are about keeping people healthy and keeping our hospital system in a positive place in the weeks ahead. I want to share some additional data that we are putting out today as well. We have been tracking an enormous amount of data and information about who is being infected, who is positive, what our hospitalization looks like. And so this is information as it relates to race and ethnicity. This information is being put out by the City of Long Beach today. It will be up on the website later today, and there will be charts that kind of give specifics. I want to give you a broader picture of what is happening, and I also want people to know that every piece of data and information is important. We monitor those that are sick, those that are healthy, and folks that are in our hospitals. And so here is a broad outline of what we're seeing as it relates to ethnicity, because this is an important piece of data for us to understand the broader picture. The first thing I will say is that what you are seeing in Long Beach is not different than what we're beginning to see in other larger cities across the country. And there is no question that the percentage of hospitalization for African Americans in our community is higher than the population itself. And so this is the latest information that we have so far. The first part is that of our total cases, the snapshot I'm going to present to you is about 60% of the total. Why is that the case? It's that we don't have full data yet from all of our private and public sources. And so this is data that is not readily available. It requires doctors and hospitals and others to bring their information in. And so when you are hearing about data as it relates to ethnicity and race in other briefings and in other cities, much of it, including in Los Angeles, is incomplete data. But it is a snapshot of about 60% of the total positive cases, if that helps. So let me just give you and run down what it looks like. In our largest percent of the population, which is Latinos and Hispanics, so they make up, the Hispanic community makes up about 42% of the total population of Long Beach. It's the largest group. And of the 42%, about 35% of the positive cases are Hispanic Latino, and about 33% of the total hospitalizations are of that group. When it comes to our white population, which is about 28% of the total population, so it's about 28% in Long Beach, 29%. We know that about 27% of the total cases is representative of that population, and about the hospitalization rate is about 22.5%. Again, all of the exact data and percentages will be available later tonight because we want to make sure the information is accurate, but this gives you the snapshot. Within our Asian American population in Long Beach, we know that also our Cambodian population is one of the largest and the largest in the United States here per capita in Long Beach. 13% of our total population are Asian Americans. About 15% of the total positive cases are Asian Americans, and about 13.75 of the hospitalizations are Asian Americans. And then we get to the real concerning number for us in Long Beach. We know that about 13% of the total population is our African American population. Of the positive cases, that tracks similar, which is about 14.3%, but of the hospitalizations, it's at 21% of the total. Again, this is a sample of 60% of the entire positive population and hospitalization population, but there is clearly our African American population is at greater risk of hospitalization in Long Beach, and that's something that we should take very seriously. It's something that we should not find acceptable, and it's something that we are working also to address. You're going to hear in the next few days information out of our health department that is going to look at how we meet this challenge, work within the community, but also take testing and other services and health services into especially our Black communities here in Long Beach. And so you're going to see some mobile testing sites. You're going to see more outreach, and we'll have that plan in place over the course of the next day or two. And so we want to make sure that the entire city is taken care of. Every single person deserves access to equal care, and we want to make sure that all populations are treated. But it's important for us to also look at this data and understand and that is something that we will be talking about in the days ahead. I want to transition to talking about the Safer at Home order that we've implemented along with the governor. I want to thank everyone for their efforts. This weekend went fairly well. Our police department continues to stress education over enforcement, and we've seen the public be very responsive to this common sense approach. Just as an example, over Easter Sunday, typically it's one of our busiest, if not our busiest days of the year in our parks, in many of our parks throughout the year. But our police officers did a great job. We had actually a total of 11 calls for activity within our parks, but due to voluntary compliance, we had no misdemeanor citations that were actually issued. Our police officers really worked to give warnings and to get people moving, and people complied, and you did the right thing. And so I just want to thank you for, I know folks weren't excited about closing the parks completely or asking us to reopen our parks and beaches. Please know that these are decisions that our health department are always weighing, but they take very seriously in the closures. And I want to thank you for doing the right thing and really staying home over this last weekend. That is helping flatten this curve that we're seeing in California. And on that issue of flattening the curve in the state, I think you're probably aware, I've mentioned before, that we and I communicate regularly with the governor, all the mayors of the big cities in the state, as well as all the mayors of all 88 cities in the county. We're all talking, we're all communicating. Relationships and supporting each other is really important here. I will tell you that over the course of the next few days, Governor Newsom, and you may have already heard this, is going to be putting out some broad principles and broad guidelines as they start having conversations, and we also are having conversations of what an economic recovery or reopening of the economy would actually look like. Now, to be clear, we're not there yet. We are under safer at home orders, as we know, through May and through the middle of May. But we know that the governor is looking right now and working with us, and we're actually going to be having a discussion about this issue late tonight about how we begin to look at how we reintegrate this reopening of the economy. And in Long Beach, as a city of 500,000 people, it is going to be very hard, and it's going to be very difficult for us to get it right, but we're going to get it right, and we're going to work on it, and I want to thank you all for your cooperation on that. And part of that is helping businesses right now that are closed with economic recovery. I want to remind all of our small businesses that we have a business hotline for anyone that has questions about closures or about needing support or grants. And the phone number for that hotline is 562-570-4249. That's 570-4-BIZ, B-I-Z. So if you are a small business or any type of business in Long Beach, you can call that hotline. In addition, we have operators on that hotline open every day from 8 to 5 p.m., 7 days a week. We're about getting information to you, and we have that service available. We also know that small businesses and others can get information on our COVID-19 website at longbeach.gov, and there's a business section right on that website where you can get all these questions answered. We have emergency microloan programs. These are loans that start at $2,500, go to $10,000. They can cover payroll, they can cover rent. We have disaster loans. We have direct access to the SBA loans through the federal government. We also have a variety of work programs to place workers into businesses that need and are looking for employees. We have programs that can assist you with job searches. If you're unemployed, we can walk you through the unemployment process. And so please use our business resources and our worker protections that we have within the city. And again, you can go to longbeach.gov, the COVID-19 page, and access all these resources. I want to also just update you on two final things. One is you're going to hear a lot over the course of this week on testing. We've been testing all weekend. We've had our drive-through testing, which is going very well. Thank you. You can sign up again at the longbeach.gov website. We want to do more testing, and that will continue. And finally, I want to end by sharing our great news on our coronavirus relief fund. Early on, during this crisis hit a few weeks ago, we set up with our Long Beach Community Foundation the Coronavirus Relief Fund. We're proud to announce that just this last weekend, we have raised now over $1 million to this fund. And this fund continues to raise resources. It's going to fund feeding low-income families, seniors who need additional care. It funds domestic violence organizations that are working with victims right now. That is a difficult time for many survivors, and people experiencing homelessness. This fund, which is now over $1 million, is thanks to all of you, to businesses, to nonprofit foundations that have all given to this amazing fund. Want to remind people that you can text support LB, just one word, support LB, and you can text that to 50155 to give any amount you can. If you give $5, any amount, you can do that. You can also go to our website, longbeach.gov, and there are areas where you can help, and in that section you can find links as well. But I want to also share with you what kind of work is being done, what kind of organizations are being funded. You have organizations like Food Finders, which is getting food to populations that need support. You have organizations like our Disabled Resource Center, which is working specifically with our populations of people with disabilities that need additional support during this time. It's organizations like Centro Cha, who are out particularly in Central and West Long Beach, working with populations, many monolingual Spanish populations, and others that need additional support and that are scared, many because are in fear of how they can get through this crisis. And organizations that we know well, that are active in Long Beach, like the Salvation Army and many others that are out there providing food and services to those in need. And so thank you to these organizations. We've already given over 30 organizations support, and I want again to thank the Long Beach Community Foundation. Would not be possible without them. And so with that, just to transition, I want to turn this over to Dr. Davis, who is going to give us a broader picture of where we're at with the health department as it relates to many of these cases. So thank you, Dr. Davis.
Thank you, Mayor. Like the Mayor said, to date there have been a total of 350 cases of COVID-19 reported in the city of Long Beach. 48 people are currently hospitalized and about 148 have cleared or recovered. 5 deaths occurred just this past weekend, bringing the total to 14 overall. And our thoughts and prayers go out to the family and loved ones. At this time, 10 of the 14 deaths and 73 cases in general are associated with long-term care facilities. The health department and the state are working very closely with the administrators, managers, and staff to quickly identify ill staff and residents in long-term care facilities, isolate and quarantine those who are ill or exposed, test exposed symptomatic individuals quickly, and ensure facilities have the personal protective equipment that they need. We appreciate the dedication of administrators, managers, and staff to provide the best care for the most vulnerable. We have not received any reports to date of COVID-19 infections in people experiencing homelessness. Cases in general in the Long Beach community do seem to be slowing somewhat. So we believe that the Safer at Home order is working. I want to thank you for the sacrifices that you're making in order to make the Safer at Home order work, and they are working and keeping people safer. Just want to transition to the rapid assessment clinic and some of the testing that we're doing in Long Beach. We opened a rapid assessment clinic on April 6th, and as of today, 172 individuals have been seen in the clinic, and 41 have been referred for COVID-19 testing. In alignment with the City of Los Angeles, we've ramped up testing through a drive-through at Long Beach City College. We're averaging 60 people per day testing, and we've tested 347 people altogether since April 7th at the drive-through facility. Individuals can screen and schedule themselves for testing at this location using the LA City scheduling platform, which is coronavirus.lacity.org, which allows qualified individuals to schedule for same-day or next-day appointments. Currently, testing is prioritized for qualified individuals or qualifying individuals, which includes those who are symptomatic with flu-like symptoms, like a cough, fever, or shortness of breath, and are either 65 years or older or have a chronic underlying medical condition. We're also working to expand testing to other locations in Long Beach in the near future. We're also continuing to test individuals at our Long Beach Public Health Lab. We've tested 454 people at our public health lab to date. The public health testing is prioritized for hospitalized patients, ill residents and staff of long-term care facilities, and sick exposed healthcare workers. And testing at the Long Beach Public Health Lab is done by appointment only. Just want to turn to some reminders in general. It's very important that we continue those basic personal hygiene measures that we've been discussing for some time now. So it's important to remember that ordinary hand soap will effectively destroy COVID-19, but it does take time to work. So you need to make sure that you're doing the happy birthday song twice, which is a total of 20 seconds, and really get all lathered up and mess around with your hands so you can get rid of the virus. We also, I want to share that last week the CDC put out advice that cloth face coverings can be used as an additional voluntary public health measure to reduce viral transmission from people who may be unknowingly infected with the virus. Cloth face coverings can be fashioned at low cost from household items or made at home from common materials. However, cloth face coverings should not be placed on young children under the age of 2, or anyone who has trouble breathing or is unconscious, incapacitated, or otherwise unable to remove the mask without assistance. Also want to do a reminder that if you feel that you may have COVID-19, you are suffering from COVID-19 symptoms, or you were tested and you're waiting on your results, or a healthcare provider, you had an appointment with a healthcare provider and they told you that you may have COVID-19, which means you need to self-isolate. So you need to stay at home and not go out, and that includes grocery shopping or the pharmacy or anything like that, but really let other people do those things for you, and wait for your test results, or if you're not getting tested, to make sure that you stay in the home for 7 days, and those last 72 hours should be without a fever or any medicines, and your symptoms should have improved. Finally, I know that the constant news can lead us to feel anxious about things we can't control, and it's important to take breaks and spend time to focus on the things we enjoy. This way we can give our bodies a much-needed rest. I also want to reiterate that it's important to stay up to date. You can access all of the latest local information on the website, www.longbeach.gov/COVID-19. And if you have any questions, call our info line at 562-570-4636. And as a reminder, we have a special extension, option 5 of that line, that's dedicated to older adults who may need extra assistance. You can also follow @Long Beach City on Facebook, Twitter, and Instagram. Thank you.
Thank you, Dr. Davis. And again, I want to, on the face covering issue, I think most folks are doing a great job of complying. I saw this weekend a lot more folks with face coverings, and I certainly saw a lot when I went to go and I picked up some food from a local restaurant. It was good to see a lot of changes also where everyone had face coverings as well. So we got to continue doing that work. I want to open this up for questions, and then we're going to have our summary in Spanish right after that. So we'll turn this over to Jake.
Hello, Mayor. Thank you for taking questions. We have individuals that are out on the line right now and have some questions. The first question comes from Jeremiah from the Long Beach Post. Jeremiah, can you hear us?
Don't hear Jeremiah's question.
All right.
Maybe he can, if he's not connected, maybe he can text it to you or send it to you.
Yeah, Jeremiah, you can send us a text if you have additional questions. The next question we're going to go to is Emily from the Long Beach Press Telegram.
Hi, can you hear me?
Yes,
Yep.
we can.
Okay, great. Yeah, so my question is regarding the citations from over the weekend. Were there any citations at all for not following health orders? Or, aside from the calls at the park on Easter?
So as far as I am aware, there were no misdemeanor citations that were issued on Easter Sunday. I'm not sure about Saturday. I don't think there were, and if there were, it may not have been very many. We can get the exact number to you from after this briefing, but what I heard from the police department, and I talked to the chief on Sunday afternoon, was that the police department was very, very heartened by the fact that folks really followed the orders, and there weren't instances where the police told someone, hey, you need to move on, and that there was any sort of issue. Everyone moved on. We are really trying to focus on warnings, and we said that now we're going to be a little tougher on citations, but that citation power from the LBPD was not necessary over the weekend. So that was a positive thing. So we'll find out about Saturday, but I believe there weren't any citations.
Thank you very much, Mayor. The next question will come from Kelly from the Long Beach Post. Kelly, go ahead.
Yes, hi, Mayor. Dr. Davis, can you guys hear me?
Yes.
Okay, this question is regards to the nursing homes. Is the city planning on releasing the names of nursing homes where we've had deaths and the number of deaths at those individual homes?
So at this time, no, we're not planning on doing that. So we do post on our website the names of the nursing homes where there have been associated cases. Once we're able to allow the nursing homes to, and all long-term care facilities to inform their residents, families, and staff. And then we also, if there have been more than 2 cases, then that's indicated as well. So that's the information that we're providing at this time.
Thank you very much, Dr. Davis. The next question will be from Jeremiah from the Long Beach Post. And hopefully we'll hear you there, Jeremy.
Hi, guys. Can you hear me this time?
Yes.
Okay, great. Thanks again for doing this. We appreciate you being able to take live questions. So my question has to do with recently we've had suddenly a big increase in deaths. We went from 3 COVID-19 deaths to 14 in just the span of a week, which seems like a huge acceleration. And do you guys know, is there a reason for that, or was this just the anticipated trajectory of how this thing was going to go? And on that note, do you guys have a model you're using to predict the trajectory of the disease, and according to that model, how bad the death rate get?
So let me see if I can remember all of this. So the first question was about why we've seen an increase in deaths. The primary reason is because we've seen this illness hit really hard in vulnerable populations, which are in the elderly with underlying health conditions, particularly in long-term care facilities. And we're seeing that really all over the country and definitely in our state. And I think that's because of the fact that it's a congregate living facility, so there's people in very close contact, and then the people themselves are at a higher risk of having really serious illness and having poorer outcomes because of that illness. So I think that's really what's driving the increase in deaths. And I think that's why we're focusing throughout the state and locally, focusing so much on our long-term care facilities, because I think it makes such a huge difference. And then modeling, I believe, was the second part of the question. Like, are there models that are predicting deaths? There's numerous models, nationally, statewide, countywide, and nothing is a predictor. They're basically putting in different variables, how well people socially distance themselves, what the hospital capacity is, and then they can give you some predictions. I do think in general, it's not surprising that long-term care facilities are being more harder hit for the reasons that I mentioned before. And so I don't think that it's surprising that this is happening, but I do feel that the social distancing is really helping. You can see with many of the models, the predictions, if you didn't do social distancing, was a much higher curve of mortality and cases, and what we're really seeing now is a little bit of that flattening that everybody's talking about, where you don't have as high of a peak, and the peak is getting pushed out.
And I'll add just to Jeremiah, and one thing that we were talking about doing, and maybe we can do it for Wednesday, and I'll check in with Jake depending on the time, is the city actually has a lot of data and modeling that is happening at our operations center. I've seen obviously some of this, the data and the way that the team is able to manipulate, dependent on what actually happens or what we can expect to happen, what different outcomes will look like at our hospitals as it relates to cases. And so we'll see if we can maybe share more of that. I know that the team wants to share more of that in the days ahead, but we have an amazing dashboard to look at that modeling at the city. And that's available also at the county and state level as well.
Thank you, Mayor. Emily, again, if you have another question, we have time for one more round of questions from our local media.
Yeah, sure. Thank you very much. I do have one question, sort of another clarifier, regarding the 73 positive cases that have been confirmed at the long-term care facilities. I I saw that the number includes staff members who may not be city residents. So does that mean not all 73 of those cases are in the city's total number?
Yes. The short answer is yes. So we wanted to give a true reflection of the impact at the long-term care facilities. And so we did say that there's 73 cases associated between residents and staff, but not all of those, for exactly the reason you said, that not all of the staff reside in Long Beach, so they're not all included in that 350 number.
Great, thank you, Dr. Davis. The next question is from Kelly from the Long Beach Post. All right.
Kelly there? No? Okay.
Kelly, are you there? All right, we'll go ahead and go over to Jeremiah again for another question.
Hi guys, thanks again. So my question has to do with how the health department's doing its investigations now. Now that we're up to over 300 confirmed cases, does the health department still have the capacity to trace all the close contacts of those people, or are you relying on them to essentially do that themselves? And how many people over the health department actually do that work?
So thank you for that question. We do reach out to every single case, and we do an interview to identify high-risk contacts, and that would include healthcare workers, immunocompromised individuals, older individuals with underlying health conditions. We are partnering more with community providers in Long Beach and the surrounding area, because it is, when you have cases going up every single day, it does become very difficult to have in-depth follow-up, if you will. But many of the providers, many of the people's doctors know them very well, and so we are partnering with them to help us with the follow-up and contact tracing and quarantining and isolation. We also did the order, so that's helpful. Many of the documents are online, and so we can refer to that when we're talking to the individuals. And I don't know the exact number of people who are working on this right now. I would say it's in the dozens, very hardworking individuals that are working day and night to reach out to people to really try to halt and lessen the transmission of this disease.
Thank you, Jeremiah, and thank you, Dr. Davis. Mayor, there's a couple of questions that are online from Facebook, and I'd like to just read one or two of those questions to you, and then we'll wrap up the question and answer for this period.
Okay.
The first question is related to antibodies testing. And Dr. Davis, antibodies testing, where is it, and are we going to do it with antibodies testing? People would like to know.
So antibody testing is in its infancy. Right now, there is over 70 companies who are marketing antibody testing, but there's only one company that's actually been FDA approved. And so there's a lot of studies going on right now to really judge how effective antibody testing is, how accurate the results are, what we can use those results for. It's thought that we can use antibody testing more to determine that you've been exposed to the virus and that you may be immune to the virus, rather than diagnosing an acute infection. But it's really all kind of in its infancy. There are a lot of companies who are making false claims. So at this point, what I would recommend is to really be cautious about utilizing an antibody test and to really stay tuned. There's going to be new information and good information coming out, and it probably will be very rapidly. But right now, there's a lot. We're still in kind of the study, figuring things out phase.
Thank you very much, Dr. Davis. Mayor, this will be the last question that we have. There is a lot of questions and comments on Facebook that we're seeing with regard to assistance for rent, mortgage, and unemployment. There's a lot of people that are very concerned about that, and I know there's a lot of programs that we've done here in the city. Can you elaborate on that support and assistance?
Sure. I mean, there's a lot happening in that area. Now, first, I think it's important to note that that there's a lot happening, but it's not enough. And so we understand that, especially low-income workers, people that are unemployed, they're looking at rent, they're looking at bills, and they're not seeing income come in many cases. So we know that is a huge issue. There's a lot happening. So I want to obviously, a lot of this information is on the COVID site, but as broadly, obviously you have to start with the congressional package that passed. Those checks and the direct checks are coming in. They are starting to come in now for folks. Those $1,200 checks. I've been advocating strongly, as have many others, that needs to be a monthly check, not just a one-time check, but people are going to need that support at a minimum every month, more preferably. And in addition to that, there is, of course, the eviction moratorium that's in place in the city of Long Beach and across the state as well. Folks should not be getting evicted if they're having issues related to COVID-19 or being unemployed or not being able to pay. We're also working right now at the state level. There are some questions about relief for families that also need to pay mortgages. We know that if folks aren't paying rent because they're not able to, then that also affects property owners. In many cases in Long Beach, these are small property owners that may have 2 units or 1 unit, and how they get by with their banks and their lending. And all of that's being looked at by the governor as well. And so folks should not, as they know, as far as utilities are concerned, we are not going to be shutting anyone's power or anyone's water off during this time, their gas off during this time. We have suspended all parking tickets as it relates to street sweeping across the city. We're working with people on as it relates to bills and unpaid bills, and we're working with the legislature in California, who's also right now sending direct relief and tax credit programs for individuals and for people. That's not to say that everything I said right now is enough. Tomorrow night, the City Council is also debating. They will be discussing a wide variety of economic incentives for workers, for small businesses, and I encourage anyone interested to visit that agenda. It is a lengthy conversation and discussion the City Council will have tomorrow night, and so I look forward to hearing that. And so that work will continue, and we'll continue to look at ways to help people. But I strongly believe that we need to get direct relief additionally into the hands of people from Congress, and that has to happen immediately. So that's something we'll continue to push.
Thank you very much, Mayor. And we want to thank you for those that have called from Q Voice News, the Long Beach Post, and the Press Telegram for your questions. And Mayor, back to you now for the Spanish information.
Great. Then I will turn this over for our health department and for Alice from the health department, who will do the Spanish summary. Thank you.
Hola, buenas tardes y gracias por acompañarnos hoy. Empezaremos con los datos de nuestros casos de COVID-19. Desde hoy tenemos 350 pruebas positivas en la ciudad de Long Beach. Lamentamos eso y desde nuestra última sesión informativa el viernes hemos tenido 5 muertes adicionales. Ahora hemos perdido a 14 personas al COVID-19 en la ciudad de Long Beach. De esos casos hay 73 que han estado asociados con centros de enfermería y de atención a largo plazo. Actualmente hay 6 centros de atención a largo plazo con al menos un caso positivo. 48 personas están hospitalizadas actualmente y alrededor de 148 personas se han recuperado. 10 de las 14 muertes están asociados con el centro de atención a largo plazo, lo hace a 70% del total de muertes. Todos nuestros esfuerzos durante esta pandemia tienen como objetivo mantener a las personas sanas, saludables y evitar la infección. Y también, claro, para evitar la pérdida de vidas. Quiero dar las gracias otra vez a todos los que se han adherido a las órdenes de salud más seguro en el hogar. Sabemos que la celebración o este fin de semana fue muy diferente para para todos los residentes, pero otra vez queremos agradecer que se quedaron en casa y no tuvimos problemas en nuestras áreas públicas como los parques y las playas. Estuvimos en comunicación con el Departamento de Policía y nos informaron que no hubieron problemas ¿verdad? Que mucha gente está siguiendo todas las pólizas de seguro en el hogar. También quiero platicar un poco sobre la línea directa comercial para cualquier persona que tenga preguntas sobre los cierres comerciales obligatorios, préstamos financieros, comerciales o seguro de desempleo. El número de teléfono de línea directa de negocios es el 562-570-4249. Los operadores en esa línea están disponibles de 8 a 5 los 7 días de la semana. Si llama después de las 5 puede dejar un mensaje y alguien del personal de la ciudad le regresará la llamada dentro de las próximas 24 horas. También queremos platicar un poquito más sobre la abertura de la clínica de evaluación rápida. Eso empezamos el 6 de abril y desde ese entonces más de 150 personas han visitado la clínica. Están haciendo los exámenes de autoservicio, que recuerden solo son por haciendo una cita previa. También hemos intensificado las pruebas de alienación en la ciudad de Los Ángeles para conducir a través de las pruebas que se están haciendo en el colegio de Long Beach. Estamos examinando aunque sea 60 personas por día y hemos hecho un total de 347 pruebas a los residentes y también en otras ciudades en el condado de Los Ángeles. Desde entonces hay planes, claro, en el futuro de expandir estas pruebas a otros sitios también. Continuaremos evaluando a las personas en nuestro laboratorio del Departamento de Salud de Long Beach también. Ahí hemos hecho un total de 450 pruebas en nuestro laboratorio del Departamento de Salud. Solo para reiterar, las pruebas del laboratorio de la salud pública tienen prioridad para pacientes hospitalizados, residentes enfermos y personal de centro de atención a largo plazo y trabajadores de la salud expuestos a esta enfermedad. Las pruebas en Long Beach se han realizado también con citas previas. También estamos trabajando para expandir las pruebas a otros lugares en Long Beach en el futuro cercano, lo que nos permitirá evaluar a más personas. También estamos haciendo todo lo posible para expandir la capacidad de atención médica y pruebas. Queremos ofrecer algunos recordatorios a todos los que trabajan duro para prevenir la propagación de este virus a nivel individual. Primero, solamente recordarles que es la manera del jabón de manos ordinario destruye efectivamente el COVID-19, pero lleva tiempo para trabajar. Por eso es que es muy importante que se laven las manos al menos 20 segundos o más. También en segundo lugar, sabemos que desde la semana pasada, cuando hicieron la recomendación para las coberturas faciales, nomás queremos decirles que nos recomendamos esas coberturas de cara para los niños de 2 años o menor. Es muy importante que no le coloquen estos pañuelos o coberturas a los niños pequeños. Finalmente, sé que las noticias constantes pueden hacer que nuestra ansiedad venga y también que desarrollemos un poco de estrés, pero nomás queremos recordarles que tomen tiempo para hacer cosas agradables y cosas para su cuidado propio y cuidado mental. Muchas gracias y gracias por estar con nosotros esta tarde.
Y muchas gracias por estar con nosotros esta tarde, ese día. Y por favor, gracias. Esto también vamos a tener todo otro día acá, and Monday, Wednesday, Friday. And again, thank you all for watching, and I appreciate everyone here, especially our amazing team at the Long Beach Health Department. So thank you, and we'll see you again on Wednesday.